How to treat and cure schizoid personality disorder. Schizoid personality disorder is a type of eccentric personality disorder. A person with this disorder has behavior that is different from most other people. For example, people with schizoid personality disorder tend to avoid social interactions, and some may seem aloof or lacking personality. However, people with this disorder are able to function fairly well in society. It is difficult to accurately assess the prevalence of this disorder, because people with schizoid personality disorder rarely seek treatment. Schizoid personality disorder affects men more often than women, and is more common in people who have close relatives with schizophrenia. Schizoid personality disorder usually begins in late adolescence or early adulthood. Causes schizoid personality disorder. Little is known about the cause of schizoid personality disorder, but both genetics and environment are suspected to play a role. Some mental health professionals speculate that a bleak childhood where warmth and emotion were absent contributes to the development of the disorder. The higher risk for schizoid personality disorder in families of schizophrenics suggests that a genetic susceptibility for the disorder might be inherited. Symptoms. The symptoms of schizotypal personality disorder. Different ideas of identity. Unrealistic goals and aspirations. Lack of empathy. Unnecessary anxiety in relationships. Needless mistrust in relationships. Odd behavior. Unusual thought process. Unusual sensory perceptions. Bizarre experiences. Cold and indifferent to emotional stimulus. Prefer to be left alone. Suspicious personality traits. Feels persecuted by others a lot. Doubts loyalty of those who are close. Paranoid behavior. Lack of friends. Poor relationship skills. Treatment. Talk therapy, psychotherapy. If you feel that you would like to have closer relationships, a modified form of cognitive behavioral therapy may help you change the beliefs and behaviors that are problems for you. A therapist with experience treating schizoid personality disorder is likely to understand your need for personal space and how difficult it is for you to open up about your inner life. He or she can continue reaching out to you without pushing too hard. A form of counseling is the form of treatment most often used. Treatment likely will focus on increasing general coping skills, as well as on improving social interaction, communication, and self-esteem. Because trust is an important component of therapy, treatment can be challenging for the therapist, because people with schizoid personality disorder have difficulty forming relationships with others. Medications. Although there's no specific drug to treat schizoid personality disorder, certain drugs can help with symptoms. Or while antipsychotics are not a routine part of treatment, they may be used to help with flattened emotions and social problems. Medication is generally not used to treat schizoid personality disorder itself. Drugs might, however, be prescribed if the person also suffers from an associated psychological problem, such as depression. Group therapy. A goal of individual treatment may be a group setting in which you can interact with others who are also practicing new interpersonal skills. In time, group therapy may also provide a support structure and increase your social motivation. Psychotherapy. While there are many suggested treatment approaches one could make for this disorder, none of them are likely to be easily effective. As with all personality disorders, the treatment of choice is individual psychotherapy. However, people with this disorder are unlikely to seek treatment unless they are under increased stress or pressure in their life. Treatment will usually be short-term in nature to help the individual solve the immediate crisis or problem. The patient will then likely terminate therapy. Goals of treatment most often are solution-focused using brief therapy approaches. Cognitive behavioral therapy. Cognitive behavioral therapy is designed to change behavior. It can be successful in treating this condition because you will learn how to act in social situations. This may reduce anxiety and reluctance to pursue social relationships. CBT is a type of psychotherapy that may help people with the condition cope with and adjust their distorted thought patterns. The CBT approach is usually short-term with a goal of helping the individual develop authentic friendships and interpersonal bonds. If the individual stays in therapy long enough for a client-therapist relationship to develop, the client may begin to reveal more about his inner experiences and distorted thought patterns that cause issues.